Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
Join Dr. Save a Life Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello, nice to have you in today's edition of You and Your Health. Today's edition will be a little bit different because I look at the event of now and consider it necessary for us to have rather an interactive section. And by reason of interactive section, it will go a long way to deliver many people who may be at the point of moving in the toll of death, as it were, simply because not just only the ignorant existing before now, the doctors are not also handy to be able to offer the right advice where applicable. So on that particular call, today's edition is going to be interactive. I have a lot of questions that I feel that it is time for us to open up. That very question of your health or a health concern somewhere, before you start drinking all manner of things, olive oil, or thinking that it's witch or wizard, can we start here from the known before we go to unknown? And that's why today I want you to invite everyone you know with any form of health concern. Call the person and say, please tune into this station. We are about to unveil one of the questions we may select today, may be part of what may be tormenting that fellow. Why not encourage everybody to tune in as we take a wonderful ride in the area of medical information and knowledge. Do that, I'll be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, and today's edition, as earlier stated, has to be interactive. And we have a number of questions that have come, so much and so many of them. Let's take this very first question. I feel is quite striking. And he said, Dr. Richard, you are truly sent to this generation to destroy ignorance. Your program on heart and stroke was live film for me and my family. My mom died in 2019 with same picture you showed us. And now just got to know my father has been stooling blood for the past 2 weeks and losing weight. Please, your kind advice will be helpful. Thanks. Okay, as an interesting thing today's edition, as we actually pointed out, I want you just to take advantage of this particular email or the number. Send a health concern of urgent imperative, as it were, in this very period where the doctors are not there. You will be able at least to receive a professional advice. Do it this way, do it there, any way you are. That could be a life-saving. Before you think that it's one enemy, one witch, or one of your friends, or someone that is after you, can we please start from the known? At this very juncture, let's look at the experience of this very family. Say that this very program has been a wonderful one, a life-saving measure in terms of delivering our people from ignorance. I do hope it has also impacted positively likewise to you and your loved ones and your friends. That is it. That is to say, whatever you get here, share. Come sharing that information. You don't know what it has been able just to do. If they have actually got to know what happened in stroke and heart, as we showed in the last time, perhaps, maybe, their mom may be living now, but we just have to say, affliction shall not rise up again, all right? So, but in this very case, it is a case of her father. And he said, the father currently is stooling blood for the past 2 weeks, all right? And in the past 2 weeks, stooling blood and also losing weight. Very striking point also to mention. And she is asking what could be done, what kind advice we can give. That advice, I know she is watching, but that is not just for her. we're also looking at it for all of us. We have friends, we have someone passing through this same thing. It's not spirit. It is something that has happened. It has killed as many as for the one that may be deadly. And we can't be sweeping all these things under the carpet. Now, let me be able just to say, whenever you see someone stealing blood, there are a lot of things that could be responsible. All right. You look at the first one, which could be looking at the aspect of the anus, and you said, what could be causing bleeding about that very axis? And the commonest among that, which causes painless bleeding. And this usually happens when somebody goes to defecate, goes to toilet, and before you know it, you see frank blood all over the place. The commonest cause of such that can be seen is what is called hemorrhoid, okay? Otherwise, we call it pile. The next one also could have what usually very threatening. They call it what is called diverticulosis. As a matter of fact, if you use a camera under what is called colonoscopy, I will show you something like that here today. If you go through the anus to look inside, you may see the entire mucosa may look as if somebody used cutlass and cut the inside. Most times you see these people will pour out blood, whoom, just like that. You know, it's usually very threatening. So it's usually called diverticulosis, but that is more common among the older people, which of course it is seen, my father, which means most probably and maybe in the neighborhood of over 60 perhaps. Another one that is of immense concern in this case, because while I call it immense concern, is that she is mentioning that he has been bleeding for the past 2 weeks and losing weight also. At that point, the first line of thought could still be said to be issue that may be cancer of the rectum, sigmoid colon cancer, or cancer about that particular axis. Why I say the cancer on the lower segment of the intestine is because if the cancer is from the upper chamber, most times before they travel down the lower chamber and come out, it comes out as black stool. That's why if you see your stool changing color from coffee color to black, that may not be that what you are eating now is turning to charcoal. No, it may be that there is a blood in it, but it is altered blood because coming from a long distance. But when the blood used to be more frank, it means that it's coming from the lower segment, which may be as a result of colon cancer or rectal cancer. But the interesting thing about this cancer around the rectum or the intestine, large intestine, is that it can be picked up as early as possible. Let me show you something here. What you see here is what is called colonoscopy. It is a camera that can go into through the anus to trace the entire wall of the intestine. So, my sister, what should be most important for your father right now is to take your father to the hospital and get this colonoscopy done. First thing first, it can be so revealing before you talk about the CT scan of the abdomen and all that. So with this colonoscopy, you can tell the inner lining, is there any problem that is happening here? Okay? In some occasion, you can find something like this. This is what is called rectal polyp. Do you know the interesting thing about it? This is the early development of a cancer situation. In most cases, this can turn to cancer. And if this is picked up at this early stage, the cancer is cured. That's why today most intestinal cancers can be cured if found early, which unfortunately most times we hardly go for health check when we feel concerned. So, but this thing you see here can be removed. And you know how it can be removed without needing to cut the body open. Through the same anus, it can now be in position to do what is called rectal polypectomy. But this is using a laser that will just go up there, burn it up, and then get it out extracted. Even in the aspect that has to do with the cancer of the intestine, if that particular surgery can now be done, even in a number of occasions, laparoscopically, without needing to cut the body open. Intestine can be resetted, and in a number of occasions, even when it is open, it can still be in position to help out. But the best result should be as early as possible. Following the cauterization, it cannot be off. This can be pulled out from that intestine, same through the anus, and this other person is free from what otherwise, if not found early, would have killed this very fellow. So when it has to do with you having any form of disturbance, indigestion, not able to go to toilet, having constipation, or any form of abdominal pain, do not wait and be drinking anything. Go to hospital first. And by going to hospital, if this be the problem, it can be identified. An answer can be given as early as possible. I do hope this is benefiting us. I want you just to keep on calling other people to join as we look at the second question. Stay tuned. I will be right back.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, a program sponsored by Dr. Save a Life Foundation. And we are looking at how much we could be able to help out in a time like this where we are living in a state of where there is no doctor. Of course, a lot of people will have a number of challenges. And come to think about it, when doctors were there, not before this strike, people still believe all manner of things, let alone at this very point in time. Before you think that it's a witch, a wizard, or one thing or the other, they will tell you, we are appealing to you that Dr. Save a Life Foundation mobilize doctors across the globe, even for some of them that are home right now, could be in position to be able to assist. If you have any health concern in a time like this, you can make use of this very email or this very number. Send it as a text message, as a WhatsApp message, or as an email report. It will be reviewed professionally, and you be advised anywhere you are. Anywhere you are. You get to the hospital as quickly as possible. Even sometimes the advice can make a lot of difference. And we have been able to see the first case of a man who was, he said the father was stolen, and we were able to mention a number of things, including a possible cancer of the intestine. All right? And we look at this very second question that let's be able to look at this. And that, I think this, let's pick up this particular one. It may look quite interesting. He said, good evening, doctor. I won't say I am getting frustrated, but honestly, something like that. I have done everything humanly possible to get my weight down, but to no avail. I am already experiencing a heart problem you mentioned in your last week program. Please, I need help. All right. This is also an interesting thing right now, and this has to do with the issue of obesity. I don't know how big she is, and she is actually calling and saying, I have a problem, and that problem has to do with obesity. I've done everything humanly possible. He said, I'm not frustrated, but it's most like I am. Of course, when somebody is having an undesirable weight, obviously there will be something like depression. Unfortunately, also, to most of them, sometimes they become aggressive because people around them will be speaking and say, no, this your weight is too much. This your weight is too much. You are eating too much. But to them, they know that they may not have been eating, as someone is actually pushing them and saying they are. A number of such situations exist. And I think I have one case of that I will probably show you here, which will enable you have an understanding. But permit me just to say this. If you are overweight or having the one they call morbid obesity, I mentioned last time that obesity is the mother of all diseases. Obese patient can trigger hypertension, trigger diabetes, trigger issue of heart-related problem. As a matter of fact, there are certain weight you will have that is not compatible with life. There's certain kind of weight you will have that is not compatible with life. Even yourself, to carry yourself and also for you to sleep, you find that it is a near-death experience in a number of occasions. Some of them will sleep and snore, and the snoring, you will know that it's either the person is in purgatory, just looking for somebody to push him small, he will fall to the other side. It happens. It's a practical experience, I'm just telling you. But I come to be of help as she actually, seeking for that right away. That help is, you don't need to get depressed. You don't need to get frustrated. Don't get angry when people talk to you concerning your weight. Don't get angry. Listen to me. Be nice enough to yourself to tell them, thank you, I'm working on it. All right? Because it is not just for ecstasy. It's not just because of you looking good. It's much more than looking good. As I earlier mentioned, heart problem can come in. The issue of sleeping apnea can come in. The issue that has to do with hypertension, diabetes, hypercholesterol, or hyperlipidemia, which can lead to heart attack and all that. I'm not threatening you with all those medical challenges, but it has been by issue of evaluation seen to be a contributing factor to most of these things we mentioned right now. So, and she is asking a question, what do I do? And here is where I give you the plan. Number one is that I will recommend a dietary management as the first line, and most importantly, with a dietitian. All right? And a dietitian will be able to make you have a protocol that will enable you people see how far that will manage. And also, additionally, exercise is one key thing that also can drop your weight. Okay? Ultimately, when all the other treatment options fail, there remaineth one that can still be in position to reduce the weight to the normal, and most importantly can help control diabetes, help to control blood sugar, help to control the issue of blood pressure, and that is what is called bariatric surgery. Bariatric surgery, you can have what is called sleeve gastrectomy. As a matter of fact, the most disturbing experience is that most of these obese people feel, I eat what other people eat. How come mine happen to be different? I will tell you what happened here. Look at this. This is the stomach, all right, that the food gets in here. And in a number of occasions, when the food gets in here, the digestive enzyme that get to digest the food as quickly as possible to get it, happen in this other upper segment of, they call it the fundus of the stomach, this particular side. So in a number of occasions, the difference between where a slim person will eat 4 cups of garri and remain the same, and another fat person will eat even half and still getting fatter, is that same food they will eat, but when the one of obese, some of them, their digestive enzyme here digest every content of whatever goes in and store them and start spreading them into the adipose tissue called the fat cells and deposit them in different places. In addition to excessive digestion of the food, the brain that actually releases a stimulation for hunger center is also located here. So this little fellow may be feeling quite hungry and more voracious to eat more because of this particular section is hyperactive in most of those obese patients. So when you do what is called sleeve gastrectomy or bariatric surgery, it will just slice off this very place. It's done without tearing the body open, laparoscopically. It can just slice off this very portion. By so doing two things, it will not allow the person to be eating too much food, and he also not be in position to become too much hunger. All right, so you could be in position to live. By so doing, within 2 months, a person over 200 kg can lose as much as 50 kg. It happens, and it gives that very excellent result. I think I have one interesting testimony here you will appreciate.
I am here to share my amazing experience to everyone. Formerly, I was weighing 230 kg, but now, as you can see, I am weighing 90 kg. You might ask, how did she do it? Well, I was a diabetic patient, I was hypertensive, and I was also obese. But through the new advanced technology called laparoscopic sleeve gastrectomy, that made a difference.
She actually was 230 kg. 230 kg. But after the sleeve gastrectomy, this happened that she currently lives her life 90. And as you can hear her, she's no longer, she used to be hypertensive, diabetic, but none of such happened now because excess fat in the body used to fuel most of those things. All right, so that is the advantage. What I'm saying here, that in a worst case scenario, it is very important through dieting, through exercise, be able to get your weight down, very healthy. However, in a worst case scenario that the weight is obvious, going towards morbid obesity, morbid meaning death, obesity with all manner of life-threatening complications, the best thing first is to start with what they call sleeve gastrectomy, which can give this kind of result. It is an amazing thing that happened in the world of the obese patient. Okay, stay tuned. I will be right back, and when I come back, we take the last question for the day.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, and today is a very unique day that we are looking at some of the questions where there is no doctor. Can you send in a question that you can receive professional advice? That is what Dr. Save a Life Foundation come up as a cover within this very period. That is the much we'll be able to offer. But be very optimistic. Irrespective of what is happening in our healthcare industry today, I can get the assurance and still beat my heart again and again that come 2025, Nigerian life expectancy will move from wherever it is right now, 54, not worthy to be mentioned, to 70 years. I've said this right now, and now I can be in position to put it to all the world governing bodies in terms of the health to watch out for Africa. There is a hope in our healthcare. The app we produce from United States will be made available for African use from next month. Watch out for it. Dr. Save a Life is going to solve the problem of primary healthcare, number one, and a number of other things that will be unveiled. I want you to be optimistic, all right? So in today's edition, we are looking at this, and we are saying, let's look at more of this before the time we cut up, and we may continue likewise, pending the situation in the country. Let's take this very one, very interesting also. He said, Dr. Save a Life, God will keep you for the great work you are doing. Thank you. I was diagnosed of goiter in 2018. I was advised to eat seafood, but the heaviness I feel around my neck is getting worse by the day. Please advise me on the best way to treat this once and for all. God bless you. No, we don't need the name. See, we are coming up with this, that in a time like this, where apparently the doctors are on strike, do not take your health into your hand. You know, say, take care of yourself. In as much as health is concerned, you need a doctor, in all honesty. In all honesty. God is saying, even in the book of Jeremiah 8 verse 23, he said, is there no balm in Gilead? Is there no physician there? Why has the health of the daughters of my people not restored? God have them under the ministry of help. For that very help we are offering in this time, believing God that the federal government and resident also will come in terms. But while that is ongoing, you can make use of this very number, send in any of your health related questions, receive a professional advice. Wherever you are, make use of advice that is given to you before you think of witch or wizard or somebody after your life. Okay? So on a very quick note, because of our time, I want to encourage you. What you have as already diagnosed is goiter, all right? But a lot of good things about it. The goiter actually has been found to become because of iodine deficiency, which today you have a lot of iodized salt and all that, supporting the challenge. But in a situation where there is goiter, you have this very kind of, somebody having a swelling, you have seen a number of them. That particular condition is something that you must have to put a close monitoring on, all right? Because it could have a problem by that enlargement. It may also be associated with the issue of hyperthyroidism, when the hormones that actually make the hormone that control the metabolic activity of the body can be in a high, so it can increase the heart rate, it can make the person to be sweating even in the cold weather, it could make the person to be losing weight. Sometimes the eyes may pop out of what is called a zoothermos, all right? You can also have other condition of the heart and all that. So it is something that if you have a goiter, number one, you must always check your thyroid hormones. If the thyroid hormones are high, that should be brought to control. The drugs to control the thyroid abnormality, the thyroid hormone, they are all available, all right? But coming to the aspect of it now becoming a discomfort or breathing difficulty, having some level of choking, some heaviness, or some aesthetic concern, all right? The answer today is that you can do a procedure on what is called thyroidectomy. Before this time around, you used to have a cut that will go here. But the most interesting dimension on the latest technology is that you can do what is called transoral thyroidectomy or transaxillary thyroidectomy. You don't need to be cut here anymore. Through the mouth, that particular thyroid hormone can be in position to be located and be taken off, or through the axilla. All right, they call it transoral and transaxillary. That is the latest technology in attending to that today in the world. That's the much you will be able to take today. And I encourage you just to be in position to keep sharing all the knowledge you get here. We can make this work. We can improve the life expectancy of our people, not necessarily giving out drugs, but just sharing the information you get today. Do you know what? Just that can save you the money you spend for burial. Keep sharing and be optimistic. Remain blessed as I see you again.